Hope your recovery from your total knee replacements is starting to go smooth. We have some suggestions for you using the Ultraslide 8. As you can see in the video, the block at the far end has been moved in significantly. So we now basically have two blocks roughly.
And flipped.
Yeah, we flipped it around too. So you've got sort of the
Nice
flat
solid
line side to push up against. It's just very stable. So you can do that with the other block too, but just to kind of give you an idea of the first exercise that's recommended, it's something we call a slide and glide. So it just gives you that ability to start on one block, slide a foot across, make contact before you draw the other leg across and bring your feet together. So you can see in this demonstration that Christy is sort of almost sinking down into some knee bend, getting that nice weight shift, and just kind of starting to build that trust again in what's going on with your legs. You should really get a sense of some nice downward pressure into the slide surface, not just pushing out against the block. And that's what really starts to do a nice job of engaging the muscles that you're trying to strengthen after surgery. The second exercise is what we call a posterior slide lunge. So again, with Christy's feet pressed up firmly against that flat side of the block in front, she's sliding one foot back, using the angled surface to kind of ride her foot up like a ramp a little bit. You can see that front knee is bending. That's where she's getting the workload. And if needed, yeah, you can kind of get that sense of, where her spine is flat, right? She's hinging out of her hip. So it's hip flexion, knee flexion, that really uses the muscles most effectively. And if necessary, I don't know if you're still using a walker, crutches, a cane, you could still keep some type of support for yourself. You could bring the back of a chair nearby, anything to make you a little more stable and secure as you're going through this exercise. And again, in terms of repetitions, again, you know your body best, but this could be the kind of thing that we might try 15 to 20 reps with each leg, multiple sets, 2-3 sets, obviously working within a comfortable range, managing pain effectively. The third exercise is what we call a lateral slide lunge. So in this example, you can see Christy sliding her left leg out. Once again, her right foot is secured up against the block or the bumper, and it's that left foot that she's shifting her weight onto. And you can see as she bends that left knee, how nicely aligned her left shoulder, her left hip, her left knee, her left ankle, everything is in alignment. She's got some support through a cane here as needed, but it's shifting into the sliding leg, and the trailing leg stays basically straight. So this is her left leg really doing the work. Once again, this could be 15, 20 reps or so. Nice low impact move at the early phase of your rehab that you're in. And then she can switch legs and doing multiple sets.